after 12. So thanks for joining me today, everyone that's called in. My name is Jacqueline Legier, and I'm the Director for the Human Research Protection Program at Horizon. And I was invited to speak on this topic, this Explorer session topic, as to provide additional information to you as researcher applicants to the REB for your research projects. And also we felt that discussing de-identification and data management practices was also in line with our Human Research Protection Program standard operating procedures. So it's going to provide you with a little bit of education related to those SOPs as well. So some of the things we're going to look at today is we're going to talk about the legislation governing the use of personal health information, specifically in New Brunswick. We're going to talk about the REB guidelines governing the use of personal health information in research, and then using personal health in research and de-identification as a strategy for safeguarding personal health information in research. So I just wanted to make a couple of disclosures. The first, I'm not a data expert at all. I am not a researcher. I am actually an administrator. I do have certification in privacy, and what that means is I have a good working knowledge of privacy legislation, both nationally and provincially. I have reviewed hundreds, maybe more, and actually probably more research study application in my 25 years working in research ethics and research administration. And I have reviewed and helped prepare multiple data sharing agreements. So really my perspective today is to provide you information from my perspective, what I see as a reviewer, as approaches to improve data protection, privacy, confidentiality of our research participants through de-identification of research data. So before we get into sort of the kind of meat of the conversation, I think we need to define what personal health information is, what we mean by de-identified, and what identifying information is. So these definitions are taken directly from FIPPA, which is our New Brunswick privacy legislation. So personal health information, I'm not going to read it all, but basically it is identifying information about an individual in oral or recorded form, and the information relates to their person's physical or mental health, family history, their registration number, meaning their Medicare number, relates to the provision of health care to the individual, or information about payments or eligibility for health care, relates to organ donation practices, identifies an individual substitute decision maker, or it identifies their individual health provider. So that's what we mean by personal health information. And you can see there are a number of things that are considered to be directly identifying to an individual. So what do we mean in legislation by de-identified? So when we're talking about de-identified, it's referring to personal health information from which all identifying information has been removed. And we're going to get into this a little bit later, but sort of what identifiers need to actually be removed from a data set so that it is truly de-identified. And then identifying information means information that identifies an individual or for which it's reasonably foreseeable in the circumstances that it could be used either alone or with other information to identify an individual. So what are the privacy laws governing research? So Section 43 in our provincial privacy legislation talks about research, and it talks about it from the perspective that a custodian may disclose personal health information to a person conducting research only if the project has met these certain criteria. So the first is that it has to be reviewed by a research review body that meets the requirements of the legislation. And the REB has to give it approval under this section, making the determination that the research is sufficient in importance to outweigh the intrusion into privacy that would result from the disclosure of the personal health information. That the purpose of the research cannot be reasonably accomplished unless personal health information is provided in a form that identifies or may identify individuals. That the information to whom the individuals to whom the information relates have consented to its disclosure, or if it's unreasonable or impractical to get consent from the person who the information relates and who's doing the research to obtain consent from them, that the research has reasonable safeguards to protect the privacy and security of personal health information. And it also has procedures to destroy the information or de-identify the information at the earliest opportunity. So it also states that an approval under Section 43 is conditional on the person proposing the research project entering into an agreement with the custodian. And within that agreement, and we see them as data sharing agreements, there must be statements that say that the data will not be published in a form that could reasonably be expected to identify the individual to whom the information relates, and that the information will not be used outside of the agreed purposes, and to assure that the research project complies with the safeguards and procedures described above. So even with this statement, if you do a research project with consent or without consent, it doesn't matter. You still have to have a data sharing agreement in order for the custodian to meet its legal obligation to disclose personal health information to a researcher for the purpose of conducting research. Those are the legal guidelines governing personal health information and research. So what does the Research Ethics Board perspective look like? What are the guidelines governing personal health information use for REBs? So I put TCPS2, which is a Tri-Council policy statement, and this is from Chapter 5. So the Tri-Council policy statement is are the ethical guidelines and standards in Canada that REBs need to follow in order to ensure that research is being conducted ethically. And institutions that receive funding from the tri-agency CIHR and CERC and SHRC have to ensure that TCPS2 guidelines are adhered to. We at Horizon are an eligible institution, therefore we are bound by the guidelines as they are written in TCPS2. So again, it's the TCPS2 specifications are very much in line with the privacy legislative requirements, which makes it a little bit easier that there is coordination with ethical guidelines and law. So basically, it dictates that researchers need to safeguard the information entrusted to them. They need to describe measures for meeting confidentiality obligations. They need to provide the REB with their proposed measures for safeguarding the information for the entire life cycle of the project, and that organizations and institutions where the research data is held have a responsibility to establish institutional security safeguards. It also states that if a researcher has not obtained informed consent from individuals, that there are certain criteria that need to be met. And for those of you who are used to submitting to our Research Ethics Board, this is embedded within the application. So if you are requesting a waiver of consent, you will be asked to meet all of these relevant standards. So you have to tell us that the information, the identifiable information, is essential to the research. You need to have it in that format in order to do your project. That the use of identifiable information without the consent is unlikely to adversely impact their welfare, that you will take appropriate measures to protect their privacy, that you'll comply with any known preferences previously expressed, that it's impossible or impractical to get consent, and that you've obtained any other necessary permission for secondary use of information for research purposes. The impracticability clause is one that we really focus on because it has to be determined that it's impossible or impractical to get consent and not just merely an inconvenience. So things that contribute to this evaluation would be a retrospective chart review with a large number of participants or your sample size is really, really big. If you've got an older data set where if you contacted participants, there is a good possibility that reconnecting with them could cause them some kind of distress, or you've got a population of patients where it's a good possibility that you may have deceased members in that data set. Those types of things would be all contribute toward that impracticability. And also if there's jeopardy to your research project. If we ask you to get informed consent, then and you would not be able to carry out your research project, you need to make sure that those sort of things are expressed in your REB application form as well. And so if you satisfy all those requirements, then the REB then may render the decision that it is appropriate to proceed with your project without getting individual informed consent for access to that information. So there's more in the TCPS too. They talk about that you're not actually required to seek participant consent for research that relies exclusively on secondary use of non-identifiable information. Here's where we get into, and we'll talk about it a little bit more, is what is actually considered non-identifiable information. And when secondary use of identifiable information without requirement for consent has been approved, and you want to recontact those individuals for additional information or for reasons related to their welfare, you need to go back to the REB and say, we didn't get consent for this information. We now want to reach out to them for additional information. So that plan has to be approved by the REB. And then you need to discuss what your plan of recontact is. And then also for researchers who propose to engage in data linkage, they need REB approval prior to carrying out that data linkage as well. Now we're going to talk about the use of personal health information in research. So there is an increasing demand for use and disclosure of personal health information for secondary purposes. And what I mean by secondary purposes, that is defined as a retrospective processing of existing data that is not part of providing care to a patient, for example, research. So if we go back to the privacy legislation, the privacy legislation is written from a perspective of protecting confidentiality when providing care. There is that subsection of research in there, but the majority of the document is relating to how do we protect information as custodians, personal health information that we've collected in the context of providing care. And so a custodian may disclose personal health information to a recipient for a secondary purpose. And these secondary purposes can be either discretionary or mandatory. And there are permitted disclosures in privacy legislation, as I just mentioned, where PHI may be disclosed without consent, and one of those instances would be research. So disclosures for research are considered discretionary, and REBs have the discretion to make the decision whether the information needs to be de-identified or not. An example of a mandatory disclosure would be a communicable disease. That would be a mandatory reporting or a disclosure, a mandatory disclosure. So when does personal health information become de-identified? So what I'm going to talk about in the next couple of slides, and again, as I mentioned earlier, I'm not an expert in this area, but I just wanted to draw to your attention that there are 18 specified identifiers that are considered to be directly identified. And in order to have your data set completely de-identified, these 18 identifiers need to be removed. And this is called the safe harbor, and it's the HIPAA legislation in the US uses the safe harbor provision for considering that a data set is completely de-identified. So what are these identifiers? So I have them listed there. Obviously, some of them are quite obvious. It's name, geographic locations, elements of dates, except the year, that are related to an individual. So if you look at the dates, a lot of times when we're collecting information for retrospective chart reviews or retrospective studies, dates are of particular interest to us. And so dates are often included as one of the variables that we want included in our data set, but it's actually considered to be an identifying information. So specific admission dates, discharge dates, birth date, obviously, date of death, all those things are considered to be identifiers. Telephone numbers, cell phone numbers, fax numbers, which hopefully will disappear soon, fax numbers, fingers crossed, especially in healthcare. Email addresses, IP addresses. IP addresses can be used to identify physical addresses. Social security numbers, medical record numbers. So for here in this institution, it's PPRN, and Moncton, it's MRN. Those are all directly identifying information. Medicare numbers, as we know. Also, device identifiers with serial numbers. So pacemakers have serial numbers on them. Of course, they need to keep track of that information in case there's a recall on that device. Certificate and license numbers such as driver's license, birth certificate, account numbers like bank account numbers, VINs, vehicle information numbers, serial numbers, website URLs, full face photos, biometric identifiers, and any unique identifying numbers, characteristics, or codes. So according to the safe harbor provision or method, if your data set is absent of all these identifiers, then you have a truly de-identified data set. So there's a statement on the bottom. So once these specific identifiers have been removed, the covered entity, which would be the custodian, must have no actual knowledge that the remaining information could be used to identify the patient. So if this is no actual knowledge requirement has been satisfied, the PHI has been successfully de-identified under the safe harbor method. So how do you deal with identifying variables? So first we need to decide whether identifying variables need to be included in the data set. And I put in there the rule of minimums. So when you're creating your data set, look at everything that you have included and say, is this absolutely integral to what I need in order to answer my research question? If there are identifying variables in the data set, two main types of de-identification techniques are randomization and coding. And I just put brief descriptions here. I wouldn't be able to go into any sort of depth of detail on what these mean, but I just wanted to introduce you to the terms so that if you wanted to do additional follow-up and look further into these, that you would be able to do so. So randomization means keep the identifying variable in the data set, but replaces the actual values with random values that look real. And an example of that would be replacing real names and addresses with fake ones. And then there's coding. So coding means using pseudonyms, and coding can also be reversible or irreversible. Next, we're going to talk a little bit about quasi identifiers. I've seen in a lot of research study applications that the application says, well, how are you going to protect and safeguard the information? Well, the information will be identified. And then I look a little bit further down or in the attachments, and I see on the data set that there are dates. So there's date of admission, date of discharge, date of procedure. And then, so that, as we know, looking at the safe harbor method, those specific dates, including date of birth. So there's not only specific dates, but there would be a date of birth included as well. Those things are what we consider quasi identifiers. So that means a variable that can indirectly identify an individual, such as a date of birth, as I mentioned, death, admission, discharge, visit, postal code, profession, or diagnosis information. So if you have to include or you have quasi identifiers in your data set, there's two main types of de-identification techniques. And I'm introducing you to the concept so that you can look at them a little bit further on your own if you'd like. I have no expertise in how this would actually work, but I do have a familiarity with the terms. So the first de-identification technique would be generalization. And that's a process of removing precision from a value to produce a more general value. It may be applied in increasing amounts. And then, so an example of that is a full date may be generalized to month, year, which may in turn be generalized to year, and then generalized to 5-year interval, 10-year interval, and so on. There was a caveat in the literature that I looked at to say when you're using generalization, you should apply it to all the rows of a variable. The next one would be suppression, and suppression is a process of removing values from a data set. In contrast to generalization, which applies to all the rows of quasi-identifier, suppression affects single rows only. So suppression of a value of a quasi-identifier may happen at different levels. And an example of suppression is it may involve removing the entire row, the set of quasi-identifiers in the row, or only the individual cell. And I provided you with links to resources and sources that I use to collect this information. But I will say that Khaled L&M is the sort of the privacy guru in Canada and has multiple publications on de-identification of personal health information. He's consulted the Ontario Privacy Commission's office on appropriate use of personal health information for research. So he would be a great resource in his articles to refer to if you're looking for additional information. So what are some other considerations? I wanted to mention attribute disclosure because I think it's really important. So this kind of disclosure occurs when one can discover something about individuals without identifying their specific or individual identity. And a really good example of that is if you were doing a survey of drug use by teens and all the respondents in a particular postal code admitted to drug use, then a parent could then infer that their teen was a drug user if they responded to the survey. So it's just really important to be cognizant of attribute disclosure. So you should consider whether any group attributes in a de-identified data set are stigmatizing before you release the data set. So what are some of my final thoughts? So de-identification, it's a process of removing information that identifies an individual or for which there's a reasonable expectation that the information could be used either alone or with other information to identify an individual. There's been increasing instances where, for whatever reason, hackers or people of interest have decided to take data sets and see if they could purposely try to reconnect and re-identify individuals. And they have been successful in doing so with even the most minimal amount of information that was publicly presented in a data set. So therefore, based on that, de-identification can be very complex and technically challenging for sure. And when attempting to de-identify structured data or data sets, researchers and institutions may wish to seek advice from technical staff or other experts in the field. De-identification results in data sets for which the probability of re-identification is very low, given the level of re-identification risk involved in the release. While de-identification techniques protect against the disclosure of individuals and our identities, they do not protect against other risks, including the disclosure of stigmatizing group attributes. So that was the attribute disclosure that I just mentioned. So approaches to de-identification range from simple cookie cutter lists of variables to be removed or modified to general loosely defined techniques such as the cell size of 5. Some of you may be familiar with that. And what that means is only if the number of individuals counted for each cell of the table is greater than or equal to 5, would you include it in your data set? So what we're asking you to consider is to determine your data collection approach and variables very early on, and to remember the rule of minimum. So this is when you're putting your research proposal together, before you even submit to HRPP and REB, is to really seriously consider what kind of information you're going to require in order to answer your research question. And also with approaches, will you be seeking waiver of consent? And what's your rationale to provide to the REB and to the HRPP for making that request? Remember the rule of minimums. The rule of minimums is one of the 10 standards the Canadian Standards Association privacy principles. That's not a standard, it's a principle. One of the 10 principles of good privacy practices is to only collect the information that you need. It's also called the least rule principle as well. Determine your de-identification method and consult with experts as needed. Consider the need for a data sharing agreement. So we We do a number of data sharing agreements with different external researchers and collaborating institutions. And as I mentioned, there are certain requirements that need to appear in those data sharing agreements. And one of them would be, you need to be very clear on the purpose. You need to be very clear on what kind of information will be shared, and that it's not to be shared outside of who the intended recipient is. So those types of things. And ensure that you have good data management practices, and to develop a data management plan very early on with your proposal development. It's important to describe what your information, your data management practices will be, and all those things to consider in a data management practice. What will you collect? Where will you get the information from? How will you store it? For how long will you store it? And what is your method of destruction? Questions?